Hola a todos y muy buenos días desde Washington,
Good
D.C.
morning to all of you from Washington, D.C. Thank you for being with us today for this press briefing here from PAHO on COVID-19. My name is Sebastian Uriel with the Communications Department here at PAHO. This session will be between 45 minutes and 1 hour long, as we have been doing every single week, and we will be accepting your questions up to the end. We have already accepted your questions via email, and you can also send your questions using the Q&A button. Please do recall to include your name and also media outlet when you send your questions. Let me remind you that we have simultaneous interpretation into English and Spanish. Today, the director of PAHO, Dr. Carissa Etienne, will be reporting on the current epidemiological situation with COVID-19 in the Americas, and she will be addressing how the pandemic is also disproportionately affecting Afro-descendants here in the region. With Dr. Carissa Etienne, we have Dr. Jarbas Barbosa, Assistant Director of PAHO, Dr. Ciro Ugarte, Director of Health Emergencies Department with PAHO, Dr. Marcos Espinal, Chief of the Department of Communicable Diseases here at PAHO, and Dr. Sylvain Aldiguieri, Incident Manager for COVID-19 here at PAHO. So now with you, I would like to invite Dr. Carissa Etienne to share an update on the region. Thank you, Dr. Etienne.
This past week, 1.6 million new cases and 22,000 deaths from COVID-19 were reported in our region. In the month of November alone, we had over 6 million new cases reported in the Americas. That is nearly a 30% increase from the numbers at the end of October. We've seen record-setting daily cases registered in North America. In Canada, more and larger outbreaks are occurring in nursing homes and assisted living facilities, as well as in hospitals, and cases are spreading among indigenous communities and more remote areas of the country, such as Yukon and Nunavut. In the United States of America, hospitalizations continue to increase, with more than 96,000 people currently hospitalized, the highest number since the onset of the pandemic. In Central America, health authorities in Honduras and Belize are closely monitoring the aftermath of Hurricanes Eta and Iota. In Panama, which has been reporting increasing cases nationwide for a couple of weeks, the Gunayala province, home to indigenous communities, has reported the highest increase. In South America, during the last couple of weeks, Brazil has been experiencing an increase in several states, while Argentina's decline in cases, a trend that started in early November, continues this week. In the Caribbean, local outbreaks have been reported in provinces of the east and the center of Cuba. This continuing increase in cases of COVID-19 is why we must act swiftly, especially in places where the caseload has not been controlled. And while we're inching closer to an effective COVID-19 vaccine, at this time, we must continue to rely on the public health measures that we can all take and that have helped to curb previous outbreaks, like relying on stay-at-home measures, practicing social distancing, and wearing masks. Vigorous government action is also needed to ensure accessible testing to identify cases, robust efforts to isolate symptomatic patients, and to quarantine their contacts. We have the tools at our disposal. Please, let's use them. I want to highlight the situation in the Afro-descendant populations. The pandemic has made it clear that this virus like other health crises, disproportionately affects the most vulnerable, especially our populations of African descent. Afro descendants represent about a fifth of all people in the Americas. They are the dominant racial group in most Caribbean countries, over half of the Brazilian population, 13% of the US population, and about 1 in 10 people in Ecuador and Panama, just to mention a few countries with significant populations of African descent. And while people of African descent in Caribbean islands may face different vulnerabilities from their peers across other parts of our region, in many places, poverty, inadequate living conditions, and limited access to healthcare puts Afro descendants at greater risk of COVID 19. Our Afro descendant populations are on the front lines of our fight against COVID 19. They are among the essential workers who power our sanitation systems, run our public transportation, care for our elderly, and tend to the sick. Despite their invaluable contributions to society, their jobs often are in the informal sector, and that makes it harder for them to work from home, to practice social distancing, or to take time off. So they are more likely to get infected and consequently at higher risk of dying from the virus. The original picture for Afro descendants is still blurred because of limited data. However, the evidence we have from some countries is telling. In the United States, the CDC reports that a Black person is 2.6 times more likely to contract the virus and twice as likely to die from COVID 19 than their white counterparts. Death rates among Black and mixed race Brazilians are 1.5 times higher than among white citizens. And in Ecuador, Afro descendants males are 3 times more likely to die from COVID 19 than their female counterparts. And they suffer 50% higher death rates from COVID than men in the country's mestizo population. This disproportional burden is not unique to COVID 19 and, in fact, is reflected across our health spectrum, from non communicable diseases to maternal health outcomes, especially for women of color who typically have a harder time accessing the health services that they need. The roots of many of these inequities are entangled in our region's long and complex colonial history, which is stained by social injustice and the enslavement of Africans, a heritage that we have not yet overcome and we see play out in our health systems. Indeed, systemic racism may pose barriers to appropriate care, result in mistrust in health providers, and ultimately cause worse outcomes for Black patients in many countries in our region. COVID 19 has shed a harsh light on this reality. And against the backdrop of urgent calls for racial equality in the United States, Brazil, and other countries in our region, we urge health authorities to face this pressing challenge. PAHO is committed to addressing this injustice, and we have commissioned a report on the health of Afro descendants to shed light on this issue and the actions required to better serve our Afro descendants across our region. We are taking this issue as a priority and mainstreaming it into our programs, including by convening our member states around an actionable agenda established by Afro descendant leaders in our region, focusing on 3 key points. First, better data. Much like COVID 19, The effectiveness of our strategies depends on understanding what is happening on the ground. Countries must do a better job at recording ethnicity information in health registries. This is key for better and more targeted prevention and care. Second, greater participation. Health programs that address vulnerabilities of communities of African descent must be developed and implemented alongside these communities. This includes Black health workers, public health experts, and community representatives, especially women, who must have a seat at the table. And third, improved access to services. PAHO is committed to universal health coverage in our region, which can only be achieved by designing programs that address the cultural and social differences that prevent populations of African descent from being adequately served. PAHO has provided member states with updated guidance to contain COVID 19 among those most vulnerable using the agenda that I've just laid out. It is also critical that Afro descendants in our region have the means to protect themselves from the pandemic, especially social protection and support systems that are required so they can adhere to public health measures. As a woman of African descent, born and raised in the Caribbean, as a doctor and a public health leader in our region, I am fully aware of the racial dimensions of this pandemic, and I'm committed to promote the change that we need. And so is our team at PAHO. Our organization was built on the principle of solidarity. When nations work together to overcome shared challenges, and when they share resources and diverse perspectives, we all grow stronger and more resilient. Today marks the 118th anniversary of the formation of the Pan American Health Organization. We were founded here in Washington, D.C. by President Theodore Roosevelt and other leaders of the Americas on this day in 1902. Since then, our union has grown and become more diverse, establishing itself at the core of public health in the Americas. It was clear then, as it is now, that health is at the very center of development for our region. After 9 months of living under the grip of COVID 19 in the Americas, the principles of our foundation remain central to PAHO's daily work on the pandemic and will ultimately pave our way out of it. The pandemic is an urgent call to action on racial inequities, an opportunity for us to do better and make good on our promise of health for all. Thanks for listening.
Muchas gracias, doctora
Thank
Etienne.
you very much, Dr. Etienne. Now we are going to move on to questions and answers. We have received some questions via email, and we also have your question through the Q&A button. Please do remember to write your name and media outlet. And we got a question by Journal Record from Brazil to request more information on Afro descendants and COVID, and another question in English that reads,
Access to healthcare for Afro-descendants and other at-risk population has been a challenge for countries in the Americas for decades. What does PAHO suggest to improve access to healthcare for Afro-descendants, enabling equity and sustainability? Doctora Etienne?
Thank you for this question. In the majority of countries in the region, Afro descendants are overrepresented in the populations with the lowest income, with less access to the social determinants like education, safe housing, adequate nutrition, and to quality healthcare. Populations in situations of vulnerability have some issues in common. They are more likely to work in the informal economy without social protection and without paid sick leave or health insurance. It is clear that evidence based information is essential if we are going to improve access to healthcare for the Afro descendant populations. And this is especially critical now as countries battle COVID 19. We need to collect disaggregated data at the first level of care. We need to strengthen information systems and analyze trends to improve access to health services. We also need to ensure that our communication strategies are targeted and data driven so that Afro descendant and other populations at risk can take the necessary actions to protect themselves and their families. Really, one size does not fit all. PAHO and countries are working to tailor their communications to reach these populations and to achieve maximum impact. To achieve these situations, the following actions are needed. We need to take into account specific needs regarding access, dealing with financial barriers, time, distance, cultural factors. We need to ensure universal health insurance. We need to ensure universal social protection. Additionally, as I've mentioned earlier, it is important to ensure more representation of Afro descendants in decision making at all levels and in critical functions, including in health services, so to ensure that health services are of quality and free of discrimination. We need appropriate communication with Afro descendant populations in health services, not only by healthcare providers, but also by admin staff. But let us not be naive. All countries must take action to eradicate inequality, inequity, and to address societal and systemic racism and discrimination. Developmental approaches that prioritize the poor, marginalized, and vulnerable populations are essential to improving the standards of living, including the health of all of our peoples.
Muchas gracias, doctora Etienne.
Thank you very much, Dr. Etienne. The next question that we have just received, many of them have to do with the vaccine. We are also receiving many questions on this topic. I will put them together. CNN from Brazil is sending questions asking, we already have 2 vaccines that are going through the emergency approval system by CDC and the FDA in the US. What are the implications? There is another vaccine that has also been approved for use in the UK. What is PAHO's position and what is the path to be followed by the vaccines to be approved for their use in Latin American countries? Dr. Barbosa, thank you. Thank you very much for your questions. Everyone is always very anxious to receive information about the vaccines. I think that there is a very positive expectation that it might be possible to have a vaccine soon to be used in the countries. The regulatory authorities are the ones to authorize the use of the vaccines. So in Brazil, it is Visa, in Mexico, it is COFEPRIS, and it is EMA in Europe. The ministries, on the other hand, that do have immunization programs, and the CDC in the case of the US, have the role of developing the strategies to determine where the vaccines will be used, what the priority groups are. So these are 2 different roles. We already have 2 vaccines that are that have presented their request in the countries, and if they as they have all of the safety data ready so that they can be authorized. Today, we heard that in the UK, the regulatory authority has already approved the use of one of the vaccines that is produced by Pfizer. We understand that in the next weeks, days, other vaccines will be authorized. For the countries that already have bilateral agreements, it is a decision to be made by the countries how They are going to request for their regulatory authorities to be able to guarantee the licensing of that vaccine. For us, that are participating in the COVAX facility through the revolving fund offered by PAHO, we have 37 countries in the region that are part of COVAX. What is the process to be followed? The World Health Organization needs to authorize exceptional use for the vaccine. That is a fast process that is already being coordinated between PAHO and the regulatory, between WHO and the regulatory authorities, so that when licensing process is over, WHO can authorize the vaccine during the emergency, and those vaccines are already being negotiated. They have already been discussed with the COVAX mechanism, with the COVAX facility, so that we can have a better idea about the number of vaccines available for administration. It is also important to highlight that the availability of the vaccine does not imply that we are going to have vaccines for everyone the following week. At the outset, the vaccines are produced in a limited fashion, and that's the reason why the recommendation will be to use those vaccines first to protect the most vulnerable individuals and to save lives. That is to say, to vaccinate first health workers, professionals, practitioners from other medical areas that are at higher risk, as well as the elderly and those that have chronic diseases. That will certainly be the first phase of the vaccination campaign. We are going to think how to use that vaccine to control transmission. That is important because, according to some, the pandemic is going to come to an end the week after the vaccine is put in the market. That is not true. We will continue to have one or two available vaccines for a couple of weeks and or months, and then it will still be possible to have diseases by COVID and also deaths by COVID. So we need to continue to implement the measures that we know work. Thank you, doctor. And as a follow-up, to this question on approval, Dora Rodriguez from Gran Rosario in Argentina and Mr. Rondon from Mexico are asking whether there is a vaccine that has been pre-approved or that has been validated by WHO. So when would that be? Thank you very much. As I just mentioned, and just to highlight this, WHO is not a regulatory authority. The regulatory authorities we have, there is a whole list of authorities that are considered regulatory authorities, considered by WHO as such, and those are the authorities that carry out the first evaluation. And to have a faster process, several regulatory authorities adopted special procedures for the emergency. For example, before receiving all of the documentation, they already start with the analysis. For example, if phase one and phase two have already been completed, the regulatory authorities already receive all of the data and start reviewing it. Upon conclusion of phase three, they add this information to the process. So this will also allow to maintain everything that is needed to guarantee a fast analysis, but a thorough analysis based on sound criteria to analyze all of the necessary data. The pre-qualification by WHO is closely linked to the work conducted by the regulatory authorities, and almost at the same time, the evaluation is conducted for that analysis, data analysis process. So the recommendation or the authorization to use a vaccine by WHO is also based on the evaluation of the regulatory authorities and also their own information. And for that reason, today we do not have any vaccine that is already available, recommended, authorized for use. This is the first one in the UK that happened today, but I am certain that in coming weeks we will have vaccines, and also the COVAX facility is already having negotiations, and they have already publicly requested proposals by producers, because we think that this path, the path to have several vaccines available and authorized by regulatory authorities, as well as with the recommendation for use and the pre-qualification by WHO, will be taking place in the coming weeks, undoubtedly. Thank you very much, Dr. Jarbas Barbosa. The next question we just received is by Tiago Gabriel from CGTN.
Progress in such large numbers and so fast in Latin America and the Caribbean? And also, how far from winning the pandemic is Latin America and the Caribbean? Dr. Espinal?
Um, Thank you for the question. I think, let me start with the second one. We don't know how far we are, because we feel we still have some way to go. I mean, the road is not yet, there is not the end of the tunnel. As you heard Dr. Barbosa saying, vaccines will not be available immediately for everyone. The world is 8 billion people. So we still need to keep implementing the actions recommended to mitigations, to keep the curve flat as much as we can. It doesn't matter if we have cases, because we're not going to get to zero until we have sufficient a number of people vaccinated, and that will take time. It's not going to be a magic bullet. But also the fact that we don't know yet if we will have to vaccinate people every year, like the flu. So there are many questions not answered. Now, regarding the factors, it's a combination of factors. This region is the most inequitable region in the world. Dr. Etienne spoke about Afro-descendants just a few minutes ago, and there are several other groups living in situation of vulnerability. It's also a region with large cities not well urbanized, or the urbanization was not really well planned, and surrounded by favelas, barrios, tugurios, everything that you know, where people live crowded and difficult to do social distance, and difficult to do sometimes even hand washing, because not everyone has access to clean water to sometimes. So it's a combination of factors, but one important factor is not to relax the measures and the actions until we are well advanced in the vaccination, when the vaccines come. You know, we are in early stages, and as WHO is saying, and COVAX vaccines will not be ready for massive distribution, except with few countries, until March or April or something like that. And then after that, that doesn't mean people will get vaccinated immediately. We have to prioritize. So let's not relax the mitigation actions that are recommended. Thank you.
Muchas gracias, Dr. Espinal.
Thank you very much, Dr. Espinal. The next question is by Harriet Hidalgo from NTN 24 in Colombia. The question is, what is the recommendation that PAHO and WHO are offering for Christmas and the holiday season to avoid transmission of COVID-19? Yes, it is very important. This is Dr. Ugarte. This is very important. I think that Christmas and New Year are two celebrations that are highly awaited by individuals to show their affection, their care for the other members of the family. And these holidays are also very important because they convey hope and union. During COVID-19, that love may be expressed best by protecting those we love. And that protection also entails implementing certain specific measures. Some individuals that may be acquaintances or that we know have been diagnosed with COVID, individuals that are symptomatic, or individuals that are awaiting results, even individuals that may have been exposed to COVID should not participate or organize gatherings with physical presence of the loved ones or attend an event. There are individuals that have a higher risk of serious infection, and often those are older individuals or individuals that require special care, and it is necessary to implement additional measures. So if for any reason we need to organize those gatherings, we need to take into account that if there is an active transmission in the community, we need to avoid those gatherings. And also, if for some reason we really need to meet with that individual, we need to establish distance. There are some very nice examples of family reunions where one goes up to the door. We just show the sign of a greeting, of a hug, without transmitting the disease and without coming close to the person. It is important to take into account that if we organize meetings, gatherings within the family, as we understand it, are those members that live together under the same roof, and those that are traveling, for example, that are coming from university or that are coming from other areas where they temporarily reside, those individuals do need to implement the right measures and, as long as possible, wear the masks during the gatherings. Once again, during COVID-19 times, the highest expression of love is to protect those we love and avoid physical contact if we have any of those conditions. And I think that Christmas, New Year are times of unity, and we need to express that by protecting and loving others. And sometimes physical presence may be exactly opposite to this. Thank you.
Thank you so much, Dr. Greta Welsh.
What are PAHO's activities in Bolivia, and what is the status of the outbreak there, particularly given the recent government transition? Dr. Aldieri?
Yes, thank you for this question regarding the situation, the COVID-19 situation in Bolivia and the PAHO technical assistance to the new authorities in Bolivia. As of yesterday, 1st of December, Bolivia has reported more than 144,000 cases of COVID-19 accumulated and almost 9,000 deaths accumulated since the beginning of the pandemic. The transmission in Bolivia is characterized nationwide as community transmission. Bolivia is a very diverse country, including in terms of ecosystem, and important difference in patterns between the islands, the mountains, and the lowlands, closer to the borders of Brazil and Paraguay. Bolivia has received really a first shock of the pandemic with a peak during July, August, a long peak, which has very strongly impacted on the health services at this moment. The hospital and health services systems in large cities were heavily impacted, and including with a number of deaths to manage. At the moment, the situation seems not to impact too much on the health services. The bed occupation rate is about 35-36% of the existing beds, and the reproductive rate, the famous RT, is clearly under 1. So this is at the moment a good signal, and this is the right moment to review / update the national response strategy. So the PAHO team, the PAHO representation in Bolivia, is working very closely with the new authorities, and also it's catalyzing the work with other partners, bilateral cooperations, and the development banks. At the moment, it's very important also. Bolivia has adopted the 9 pillars of the regional response strategy against COVID-19, the fight against COVID-19, but also is now adding a new layer and a new component, which is the vaccine preparedness. And Bolivia is part of the COVAX mechanism, so, which is coordinated by PAHO in our region, in the region of the Americas. I'd like to add also that Bolivia is working in the context in a strategy of primary healthcare, in the context of universal health system, in Spanish, Sistema Único de Salud, and is working hard on this. And the plans are aligned with the existing frameworks. But I'd like to highlight, using the experience of the first impact of the pandemic on Bolivia, I'd like to highlight 2 important pillars among the 9 pillars. The pillar of infection prevention and control. So in this case, PAHO is working very closely with health authorities regarding the implementation of the very strict procedures in health services for infection prevention and control, including the access to personal protection equipment and all the logistics that is attached to this. And the second point, the second pillar I'd like to highlight, it's the expansion of the laboratory network to the local level, to the subnational level. Bolivia has national reference laboratory, the CENETROP, in Santa Cruz de la Sierra. But now the PAHO technical cooperation is going to the integration, the inclusion of antigen detection rapid tests for ensuring at primary healthcare level a better coverage, detection, and control of COVID-19. So I hope that I answered the concerns of the journalists from DEVEX. Thank you.
Gracias, doctor. Me gustaría darle la
Thank you
palabra.
so much, sir. I would like to give the floor to Nurit Martinez. She is reporter from El Sol from Mexico. Nurit, can you hear us? You have the floor.
No, no está funcionando.
It looks like she is not there.
No, al parecer.
Apparently, Nurit. Oh, hi there. Thank you. Good morning, and thank you so much for the opportunity that you have given me. Greetings from Mexico. I would like to ask the director, or Dr. Barbosa, and this has to do with WHO's announcement that says that Mexico should take the pandemic seriously, that there are very serious indicators about Mexico. What are those indicators that are cause for concern to PAHO and WHO about the management of the pandemic in Mexico, and if Mexico should correct the strategy, or if Mexico would go back to total confinement because of these statistics? Thank you, Nurit. Dr. Barbosa, could you please answer? Thank you so much for your question. Yes, the Director General of WHO in the last press conference mentioned not only Mexico and Brazil, because they are very important countries in Latin America. These are the 2 countries with the highest level of population. And also, after a reduction of cases of several weeks, in recent weeks, they have shown a high increase in the number of cases. So the WHO wanted to call the attention to this, and we do this to all the governments, because we, of course, understand that there are social and economic pressures, and many times people believe that the pandemic is ending or that it's not so serious. So I think this is just a call so that the country reviews the situation in countries like Mexico and Brazil, many times we have a difference between the different provinces, the different municipalities and states. So maybe the health authorities can review the data very carefully and then to see where there's an increase in the number of cases. And then the number of bed occupation in hospitals, so that they can adopt proper measurements. And if it's necessary, they should go back if necessary. If they have opened up and it is too much, then they should go back. This is something that should be considered because we have the data, we have the situation. And in many countries, other than Mexico, we also have this situation. So this is just a call to action, not only for the governments, but also for the community in general and the population in general. The pandemic has not ended, and we are trying to reduce the number of cases in some countries. In some countries, it has stabilized. But for that reason, it is very important to make sure that through our actions, we identify these changes and see where we can act. Thank you, Dr. Barbosa. The next question is from Melina Ochoa. She is a reporter for Uno TV in Mexico. Does PAHO think that we could have a very strong bacteria when we use medicines against COVID-19? Yes, thank you so much for your question. I see that in many countries, they are using indiscriminately antibiotics, and this is a viral disease. Yes, you can use antibiotics if you have a risk of an extra infection. Many times that happens in our hospitals and health centers where we cannot have proper control and prevention of communicable diseases. Yes, you can use antibiotics under the strict supervision of a doctor and clinicians. But there are super strong bacteria that are resistant to everything. Viruses, bacteria, fungi, everything changes because of mutations. And we have the Enterobacteriaceae and other diseases. And these are bacteria that have shown resistance to most antibiotics. So we should not use antibiotics without proper prescription, because then this will not affect COVID unless the person presents a concurrent infection by a bacterium. But we could not use antibiotics as prevention for COVID. COVID is a viral disease. Only 5% of some people require hospitalization in some cases. So it is important to protect antibiotics because we have a quote-unquote pandemic of overuse of antibiotics. Yes, we have to protect the use of antibiotics. Thank you so much, sir. Now we have a question from Claudia Luna Palenca. She is a correspondent in Spain of the Vertigo journal. Claudia, can you hear us?
¿Ahí me escuchan bien?
Yeah, can you hear me?
Hola, muchas gracias por esta oportunidad. Un saludo desde España. Sabemos que Pfizer ya ha sido pues aprobado para empezar a distribuir su vacuna en Reino Unido. La pregunta que nos llegan de los ciudadanos, no solamente en Latinoamérica, sino en Europa, es la logística de estas vacunas, de la de Pfizer, la de Moderna, las que están con el RNA mensajero. Es decir, si nos
with
pueden platicar un poco de estos
mRNA messenger.
refrigeradores especiales,
If you
si
can
cualquier
tell us
congelador se puede
about
habilitar
special
para congelar estas
freezers
vacunas a
that we
25 o
could
70
use
grados bajo cero.
when
Aquí en
we
España
have
se habla de
to
13,000 puntos de vacunación.
get
Significa que
equipment
habrá
for
13,000
proper
congeladores. Si nos
freezing
platican un
of these
poco, por favor.
vaccines.
Gracias.
And here in Spain, we have all kinds of these equipment. In addition to Claudia's question, talking about the logistics, Tanya Smith-Catwine from Bahamas is asking, well, how is PAHO or how will PAHO assist the countries in the storage of these vaccines? And Angeline Montosa, Le Monde, also would like to know what mechanisms will be put in place to help the countries storage the vaccine. Dr. Barbosa, thank you so much for your questions. That is a very important challenge. It's not only a matter of just having the vaccine, but having the capacity for distribution to have an adequate strategy to use the vaccine. And then we will not have thousands of doses of this vaccine. So PAHO is working with technical cooperation partners to draft this strategy of vaccination because the supply of vaccine will be very limited if we think about it. So these are aspects that we are working with the countries. Logistics will be a challenge for the Pfizer vaccine because that vaccine has to be stored at minus 70 degrees centigrades. So that's a challenge because with this capacity, we only have a few research labs where it is necessary to store this. The other vaccines, Moderna, for instance, have characteristics that will be used within the cold chain existing in the countries. And some of the special stages in the preparation for vaccination is exactly the review of the logistics in the countries of Latin America and the Caribbean. And the countries of Latin America and the Caribbean have a very good experience in vaccination, in taking vaccination activities to all areas, even in areas that are of difficult access. But now we have to review all of this chain of strategies and logistics to see what is most important. For the cold chain, for the Pfizer vaccine, in addition to the freezers for storage of the vaccines, we are developing, and this is information that is coming from the producer. We are developing a means of transportation of this vaccine. And when the Pfizer vaccine gets to a vaccination center, it doesn't need to be stored at minus 70. It could be stored in common equipment that we have at 8 degrees centigrade up to 5 days. So these are measures that are being under review in each country. So in addition to technical cooperation, we are working through our strategic fund for the procurement of supplies for the countries. We have contacted several manufacturers of freezers for those countries that are interested in acquiring the Pfizer vaccine. So we have to adapt the vaccines distribution to the reality of the countries. And the great advantage of COVAX is that we have this facility to be able to offer the vaccines to the countries, and the countries can state their options. And then the degree of investment that will be needed, the type of intervention that will be needed for the distribution of these vaccines. And it is good for the countries to have all of these options on the table and to have all the information that they need to be able to have the best choice as to the vaccine that they will be using, what will be the system of vaccination in terms of protection for the personnel that will be administered the vaccine, and then also for communications. So we are just taking into consideration all of this within the framework of vaccination campaigns. Thank you so much. Now I would like to give the floor to Gisela Salomon from AP for her intervention. Yes, can you hear me? Good morning. Thank you so much for the conference and for the opportunity to ask questions. I would like to know if you can give us an update. I think Dr. Barbosa mentioned this, but can you give us details as to what's going on in the countries of Latin America? How many countries are committed to participate? If you can tell us if at some point in time some of the countries that cannot finance this vaccine will receive financial assistance. We have talked about El Salvador needing financial assistance, whether you have established a dialogue with these countries to offer them financing or help. And then in the case of the Pfizer vaccine, will the Pfizer vaccine be part of the group of vaccines offered by COVAX? And will this be able to reach the countries most in need? Thank you, Gisela. Dr. Barbosa? Thank you so much for your question, Gisela. Yes, the COVAX objective is to guarantee equitable access. We know that in public health emergencies in the past, the poorest countries, for instance, when we had H1N1 influenza, the poorest countries of Latin America and the Caribbean received the vaccine 6 to 8 months after we started distribution. But we have a mechanism for distribution for 187 countries, and it covers about 90% of the population of the world, and this is covered by COVAX. In Latin America and the Caribbean, we have 27 countries that are participating as self-financing countries. That means they will be paying for the vaccines. And we have 10 countries that will be receiving the vaccine, but they will be receiving it free because they are the poorest countries according to the criteria of PAHO, and because of the small population, they have more difficulty in access. So Gavi, which is the leader in COVAX, has been working on this. 10 countries of the region that are under these conditions of receiving the vaccine without pain are Bolivia, Dominica, El Salvador, Grenada, Guyana, Haiti, Honduras, Nicaragua, St. Lucia, St. Vincent, and the Grenadines. The other 27 countries are countries that will be paying for the vaccine. The process for bidding is in the first place, and within this process, PAHO is working on it through the revolving fund and with input from UNICEF. We are beginning to receive bids from all the producers, including Pfizer is participating in this. And all of these manufacturers have told us about the amounts that they have and how much of the vaccine will be able to be delivered during the first phase, during the second phase, etc. So we have all of this covered with all the characteristics of the vaccine so that we can send it to the countries. So all the countries of Latin America and the Caribbean that are participating will be benefiting from COVAX. Even the countries that have bilateral agreements with some producers will also have the COVAX facility as an option. And all the initial negotiations have provided very good information. COVAX is calling upon the producers to present proposals with prices that can be accessible to the different countries, and that should be an advantage to the countries. So we are working with the producers so that they can have prices that people can pay. Thank you so much, Doctor. We are reaching the end of this press conference. We have several questions, and now I would like to ask Lidia Lopez from La Prensa in Nicaragua. Lidia, can you hear us? You have the floor. Please go ahead. Lidia? Lidia? I think we've lost her. Lidia, can you hear us? You have the floor for your question, Lidia. Please go ahead. It looks like it's not working. So, Lydia's question was, what is PAHO's opinion about the fact that in Nicaragua we have a system of control and surveillance in all the areas affected by the hurricanes, and the health system has the responsibility of working with these tests and the vaccination availability. What are the recommendations of PAHO to the Ministry of Health? Dr. Ugarte, can you please answer? Thank you so much. Thank you for Lydia's question. Regarding the effect of the Eta and Iota hurricanes in Nicaragua, we have information that the shelters are being visited by health personnel, and I think health surveillance should be inherent to the health services provision and report the cases through surveillance system. In that sense, if fever cases or any other cases are detected, they should be reported and should, through that, enrich the surveillance. As you know, we have very scattered reports with scattered data, and so we do not know what's going on in the shelters in that area, but we could say that there's some degree of epidemiological surveillance. Regarding tests, it is necessary to identify cases, especially symptomatic cases, in order to reduce the COVID transmission and also to avoid hospitalization of serious cases. And I think Nicaragua has received the recommendation of the decentralization of tests. This recommendation has been issued to many other countries. So many countries have decentralized their tests, and many countries have authorized private labs to conduct these tests. Several Central American countries have done so: Honduras, Costa Rica, El Salvador. And for that reason, we have been working with the Ministry of Health of Nicaragua and many other sectors to be able to decentralize these tests and also to test as far as possible all symptomatic people. When tests are centralized, many times we do not get there on time. So the governments protecting the population report on the results immediately. So we consider that after the hurricanes and after the projects being developed in Nicaragua, decentralization of tests is one of the main commitments by the institutions to be able to control COVID-19.
Thank you very much, Doctor. And now we are going to move on to the last question today. This is a question by Eduardo Seco Carston. In English, it reads,
So thank you. And I think we've had many questions about the vaccines and particularly access to vaccines. So PAHO and the countries of the Americas have shared a strong history of solidarity, leaving no country behind. For more than 40 years, PAHO's revolving fund for vaccines has helped the countries of the Americas to protect people against some of the world's worst diseases, including polio, measles, yellow fever, rotavirus, and HPV. So there is a good track record. Through the fund, member states pool their national resources and their demands to procure high quality, life saving vaccines and related products. The revolving fund is a cornerstone of 42 countries and territories in the Americas to ensure safe and high quality and equitable access to vaccines. PAHO has provided broad support to the countries of the Americas regarding the operations of the COVAX facility and understanding of its benefits and scopes. And Dr. Barbosa has spoken to this several times. In the Americas, regional solidarity led to an unprecedented level of participation in the COVAX facility. As Dr. Javas mentioned, some 27 self-financing countries and territories have signed the commitment agreements, and plus there are 10 countries that are eligible for the advanced market commitment, giving them access to vaccines. The timely access to COVID-19 vaccines is one component of PAHO's overall technical cooperation package that provides broad support to member states in country readiness for the introduction and deployment of COVID-19 vaccines. And Dr. Barbosa spoke to this as well. This includes immunization program planning and budgeting, demand planning and prioritization of target groups, harmonization of the national regulatory processes, supply chain and cold chain strengthening, surveillance, health workers training, program managing and supportive supervision, service delivery, monitoring and evaluation, social mobilization and communications, evidence-based decision making, and other areas of need that have been identified by national immunization programs. So this whole support for access to the COVID vaccine is quite a package. Under the COVAX facility, the PAHO Revolving Fund and UNICEF supply division mechanisms are recognized as the main procurement agents, with the PAHO Revolving Fund dedicated to purchase COVID-19 vaccines for all interested countries. In close collaboration with UNICEF, the PAHO Revolving Fund has been co-leading the preparation of the procurement strategy for the COVAX facility. A joint UNICEF PAHO international request for proposal, the RFP, for the COVAX facility was issued on the 12th of November. And PAHO is in continuous discussion with our member states to ensure that they are fully on board, that they fully understand, and that they are ensured that PAHO will deliver the technical cooperation that they will require to ensure that their populations have access to vaccines and are successfully immunized against COVID-19. Thank you so much.
Muchas gracias, doctora Etienne. Ahora sí hemos llegado al final
Thank you
de
very
esta
much,
transmisión.
Dr. Etienne. We have reached the end of this press briefing. Thank you all for being here with us today. We are also celebrating 118 years of life here at PAHO and also work to improve the health of the population of the Americas going back to 1902. So briefly, we will be sharing with you the opening remarks by Dr. Etienne as well as the recording of this session. We apologize for not being able to answer all of the questions sent today because we were short of time, but you know that you can continue to contact us via email. So thank you all again and see you next Wednesday. Greetings.